Joining us again for another edition of our virtual Connect series that, as many of you know, started to basically keep our readers and our partners informed about very, very topical situations that are going on throughout all of this craziness that has really just consumed the past 7 months for us all. Our latest topic is an extremely important one, and one that's very, very near and dear to our hearts, both Bridget and I and Jolynn, based on philanthropy and what COVID has done to a lot of our healthcare philanthropies that are out there, and some of the situations that are there as we roll forward and where we're going to move as we go into the future as well. So, a couple little things that I think some of you have heard me talk about before. When we start our panel discussion, we're going to place you all on mute. If we miss you, please mute yourself, just to be gracious to our speakers as we roll through this. At the end of the discussion, we will take everyone back off of mute, and please feel free to stick around and join the discussion, ask a couple more questions that you might not have had a chance to get out there during the event itself, because our panelists do tend to stick around and hang out and answer some of those questions for us. So that's always kind of fun. Grab a cocktail and hang out for a little while longer, some longer than others, and that's okay. Feel free to use the chat behind the scenes to talk to each other, because obviously, as you all know, we do this a little bit differently than just a talking head on the screen. We'd like you to interact when you're seeing folks that maybe you haven't seen in a while. Use that private chat if you would like to reach out to someone that you haven't seen in a while and just kind of reconnect, because that's always fun and always a good time. And the biggest rule is behave. Behave, behave, behave. That means you, Hessel, behave. Because we are wide open and we can see everyone, because we did not shut your video off. So with that, I'm going to pass it over to Bridget so we can get started and rolling with our conversation. Again, thanks everybody for coming.
Great. Thank you so much, Jason. We love that you guys signed up for this really important conversation. When the American Cancer Society, and more specifically than that, Roy Hellwich, reached out and asked if we could have this conversation, I realized that even as involved as we are in, I chaired the diabetes walk. I'm the current chair of the Alzheimer's Gala. Jason does Real Men Wear Pink. I'm on CEOs Against Cancer. You know, we're super involved in all these organizations, but it had never crossed our minds what the impact of this whole pandemic had been on these different nonprofits. And so we felt compelled to do our part and to convene our leaders, which we're very proud to be able to do. For those of you not familiar, the quick overview of TBBW is we're a CEO-centric publication that does digital and print and events. We have 15,000 CEOs that our magazine gets delivered to every month. And from the very beginning, philanthropy has been a huge focus of what we do. We make our cover CEOs talk about their philanthropic efforts. We do whatever we can to highlight the different nonprofits. And they need us more than they have ever needed us right now. So I'm really proud to be hosting this conversation, and want to thank Roy and ACS and obviously all the other panelists and sponsors. But it warms my heart that we get to host this conversation. I'm not sure if Jason said it, he may have. You can submit questions. We don't typically have a ton of time at the end to get to those questions, but we will certainly do our best. I think there's emails available in the chat for you to send those questions to. And, you know, we had sponsors. Obviously, these organizations are hurting. The last thing that they could do was purchase their own sponsorship. So I'm very, very proud of the companies that stepped up and said, yes, we will support you so that we can have this conversation. So if you would please give them a moment to talk about the reason that they chose to sponsor these different nonprofits here today. And I'll start with Baycare and Dr. Kazi.
Hi, Bridget. Thank you for having me. Baycare is very proud to be sponsoring the American Diabetes Association seat tonight. Patients with diabetes have definitely been affected by the COVID pandemic in lots of ways, and we're very happy to be a part of having this conversation tonight. Thank you.
Great, thank you so much. And Tracy Hayes with Cigna.
So Bridget, Tracy was having some computer issues. I think she lost her connection and was trying to get back on.
Oh no, all right, we'll move along and see if she gets back on. Roy Hellwich with Pilot Bank.
Yeah, thank you, Bridget. Well, I'd like to start again by thanking you very sincerely and the entire team at TBBW I think your willingness to address critical issues right now and is really a very strong positive for our community. And I mentioned to you before that the recent virtual connect on race relations, I just thought was right on point. So thank you for your leadership and really a strong sense of civic responsibility. We all appreciate that. I think today's meeting, Bridget and everybody, is no less relevant than the meeting on race relations. I think it's equally as important. All three of these organizations, I'm sure, are facing tremendous operational and financial stress right now. And all three just do wonderful things for our greater community, and they deserve our support and appreciation. I have the distinct pleasure and privilege of working with Brant and the entire team at ACS. And I can tell you firsthand that, the American Cancer Society on a national basis is facing a funding shortfall north of $200 million. I mean, that's incredible, a large amount, and critically, it's having a very significant and negative impact on cancer research right now. So, and I'm sure that's true with all three. So again, Bridget, thank you for hosting today, and thank you for letting Pilot Bank play a small role today. So very much appreciated.
And I have the privilege of sitting on CEOs Against Cancer with Roy, who is our chair this year and is doing an amazing job. So one more time, let's see if we've got Tracy from Cigna with us. Tracy, are you there?
Yes.
Okay.
Yes. Good time for my computer to freeze. I'm sure everyone's had that happen before. Thank you so much for the opportunity. I'm so excited to be here today because I think this is a very important topic. I think that for nonprofits especially, this is a very difficult time. It's difficult for our employees and their families. Cigna just rolled out, we actually did initiated a survey of about 16,000 Americans and found that 3 out of 5 are at risk for resiliency. And that has become a very important topic. So I would like to encourage you to go on to the cignaresilience.com website. There'll be resources there for you, for your employees, as well as a questionnaire that you can take that will help you determine, how strong are you, how strong is your resiliency as we continue to move forward in this pandemic, the issues we have with social injustice, economics. So it's a very difficult time for you, for your employees, your family. So I would encourage you to spend a little time looking at the Cigna resources to help you. But again, I'm very excited to be here, very excited to sponsor. I have a personal involvement with the Alzheimer's Association as I've had 2 aunts and a mom who passed away from Alzheimer's, and this is a very important organization to me. And so I'm just very excited and passionate about this panel discussion today. So thank you.
Thanks so much, Tracy. And for those of you who care, she's the reason I'm chairing the Alzheimer's Gala. She gave me way too much wine and said, just say yes. So it's been an interesting year to be a gala chair. Let's just leave it there.
True.
Yeah. So I'm not going to read bios on each of the panelists, but I'm going to ask them a question, and that would be a great opportunity for you guys to just say who you are and what your job title is and who you represent. So I don't want to waste any more of our, well, not that it's been wasted, but any of our time being able to answer questions. So I want to move right into that. Some of these were submitted by the audience, and some, we're not the experts. We asked the experts, what should we be talking about? And so you'll get a good mixture of that with the questions. So I'm going to jump right into it. Angela, I'm going to start with you. Many nonprofits rely heavily on events for fundraising. Some have created virtual events to try to replace the contributions lost from canceled in-person events. How successful have those virtual fundraising events been? Have those events allowed the nonprofits to expand their reach geographically because they're virtual, or is it just the same audience as in the past? And I know you're going to kill me for leading with you on this one because we didn't do ours, we moved it, but I'm sure you have some input.
No, it's fine, Bridget. Thank you so much. And thanks so much for allowing us to be here. Just by means of introduction, my name is Angela McCauley. I am what's called the regional lead for the state of Florida for the Alzheimer's Association. So I oversee all of our operations for the state of Florida, but I'm based right here in Tampa Bay, and I also serve a dual role of chapter executive for our local market. So to answer your question, it's a really great question, actually. We've kind of been on a unique timeline with the pandemic. So we closed all of our offices in March, as everybody did. And really since then, we've only had one event that's actually taken place that we kind of pivoted, everybody drank, to try to really incorporate that into the virtual environment. And that was an event that we do called The Longest Day. It's a really unique event where it's kind of like a DIY fundraising event. So the participants come up with their own ideas of how they're going to fundraise, and a lot of them host events where you would normally gather and they do fundraising. So barbecues or some kind of party gathering of some type. So we had to really quickly shift into coaching them to converting into virtual fundraising events. So we have had a component of that, maybe a little different than what some of my counterparts have experienced. But what we found, going to that kind of geographical question, is where you might have had a TLD, we call it the longest day, where you might have had a TLD team that annually would do a family game night, and there would be fundraising activities around that. They were able to transition that into a virtual family game night, which enabled them to include more family from outside of their local market, out in other states, some even in other countries, were able to join their virtual event. So it did kind of expand their reach geographically that way. But what we have noticed is that even though people are still engaging in our events, and in some cases, really even more people are engaging, they're fundraising less. It's just harder to raise those funds right now in this time. As Bridget is well aware of, we postponed twice our gala that would have been right here in Tampa Bay because of the pandemic. And so we're still kind of working out what that might look like for next year and hoping that we will be able to gather and not have to go virtual. But we have nationwide had some gala events that went virtual, and we did find that the engagement just wasn't the same. You're not raising the same amount of money, and these events are really about that relationship cultivation too. So not being able to be there in person and have those conversations and rub elbows with your peers, it's not that same field as you would expect. Our biggest event are our walks to end Alzheimer's. And so our walk season is literally just starting. We have our first event this Saturday in Pinellas County. And though we're not saying it's a virtual event, what we're saying is you're walking everywhere. So we are still walking, we're walking everywhere. And we're asking our participants to walk where they're comfortable with who they're comfortable walking with, to make sure that they're staying safe. But we've continued to try to convert more to that virtual fundraising. Facebook fundraising has been really big for us, and just encouraging everyone to stay safe and walk where they're comfortable.
Well, I didn't plan it this way, but I happened to have attended the virtual Cattle Barons Ball last Friday night, and my husband's on the call. We can tell you we had a great time and we were very engaged. So Brant, why don't you talk about what's happened to the American Cancer Society in the same question? Okay, if anybody has a Zoom bingo card, you're on mute, Brant.
You can always count on me for that. So with leadership from Alex Sink, Burt McBride, and Alyssa Krantz, the event went very, very well. But first off, Bridget, thank you for putting this together. We appreciate your leadership in so many ways, and this is an important topic. And obviously a big thank you to Roy, Rita, our great friends at Pilot Bank, for sponsoring us with this event. Much of what Angela said, I could say ditto to. We are struggling greatly. We are all organizations that thrive by bringing people together around our efforts. Whether that's a Relay for Life or Making Strides Against Breast Cancer or our Cattle Barons Ball or the other walks and events at Alzheimer's and diabetes, we have built our organizations bringing people together. And March happened and it all came to a halt, and we are all trying to figure it out along the way. And so for us, certainly our walk season, our Relay for Life season was right there when it started. And we had to suddenly halt and pivot. Everybody drink. We are using pivot in our language at ACS as well. But we have been able to, there are some silver linings by going virtual, I think, that we've seen that are really important. And obviously, Angela was right, and that, we miss so much bringing people together around these events. And we have abbreviated our Cattle Barons Ball. It was an hour plus versus a whole evening. But we were able to probably, through that event, not only have some fun virtually, but maybe spend a little bit more time specifically on the cause and the impact that people are making, and speak in a different manner than you would with 1,000 people in a room or at a venue, and really help people understand what they are supporting a little bit more. And so we certainly missed the conversations, the in-person. We want to bring them back, and we will do as soon as safely possible. But we are seeing, we're getting better and better at some of the virtual opportunities. We are very similar to what Angela talked about with the Alzheimer's Walk. We have Making Strides coming up. And that is being led by Beth Garland from Ultimate Medical Academy. You mentioned Real Men Wear Pink, and people are figuring out how to do it on their own, still coming together in smaller groups and making an impact on this disease. So we want so badly to bring people back together, but until then, we are making the best of it.
So obviously we did the same thing, right? We pivoted, everybody drank, and went to a virtual event platform ourselves. And actually in the office, we've said, why would we stop doing these, right? We won't do them as frequently when in-person events are back to being acceptable. But we will continue doing virtual events. And so I wanted to ask Pratima, do you think that this maybe is something that's going to continue for the nonprofits, that maybe it'll be an add-on even when in-person events come back in?
Yeah, thanks, Bridget. Again, thank you for having the American Diabetes Association be a part of this panel. We really appreciate it. And thanks to everyone else involved as well. And for sake of introduction, my name is Pratima Prasad. I am the director here in Tampa, but I now cover the state of Florida. And that's due to pivoting. So as far as events continuing to be virtual, we have seen success with our virtual events. And like Angela mentioned, we've had the success with the number of participants increasing and our, geographical area being covered, having a wider area covered, but the fundraising is lacking. So it is really hard to fundraise in this time. And it's of course due to a lot of people losing their jobs and just life being so different from what it was in January. So the ADA, like many other nonprofits, we haven't been immune to the economic downturn caused by COVID-19, but organizationally, we did kind of tighten our belts and adjust some of our budgets. So thankfully, we were able to do so without affecting or impacting our mission. So all of our funded researchers were able to continue their important work, and our advocacy team has been able to continue the important work of making insulin affordable without interruption. So we're really proud of that. And I do have some background on that if you guys are interested in knowing about the insulin affordability that we've been able to put in place and we're really happy with. But again, it's, our budgets have been impacted to where we've had to decrease events.
That's a great segue to what my next question was. So I'll let you talk about it. And so what the question was is, how has the financial impact and social distancing caused by COVID impeded your ability to service your constituents in the community? Have you had to cut any programs or services?
Yes, unfortunately. So we've had to cut more of events and staff as well. So when you cut staff, you obviously will have to cut programs and certain in-person events. So now instead of having a Tampa Bay Tour de Cure event, we'll have a Florida Tour de Cure event, and that will take place in Lake Nona. So in Orlando, it is one of the larger events in the state of Florida. So instead of having 5 events in Florida, we now have 2. So we have a big step out walk that's actually Saturday. It's coming up really quickly. And again, we've had success with the participation, but the fundraising has taken a hit.
Angela, would you like to answer that question as well?
Sure, thanks, Bridget. You know, we have definitely seen some impact in our programs and services because of COVID. We have been really fortunate to, you know, really within 10 days of closing offices and being home-based, we're able to convert all of our programs and services to a virtual platform. So within about 7 days, we had all of our support groups that were either being a phone conference or web conference. And, you know, within probably another 3 or 4 days, had all of our educational sessions that we typically offer in the community around the warning signs of the disease, you know, and just kind of knowing the basics. And there's a variety of educational programs that we offer to those who need it based on the different levels of the disease. So whether you're early staged or later staged in the disease, we've got programs around those that typically would be in person. So we've been able to convert those to virtual, so we're still providing those. But then we even found that with, you know, caregivers being so overburdened anyway, and those are predominantly the individuals that are participating in our programs in the community, that they were having a hard time even getting on virtual because of all of the other stressors happening. So we took it a step further and were able to convert those to actually on demand. So you can go online and you can actually participate in those programs as you need to. You know, if you need to stop it in the middle because your patient woke up from their nap, then you can stop it and come back to it and still get that education. So it certainly has been a shift, but we've not had to stop providing any of our services. We've just had to get a little creative in how we do it. I think the biggest impact that we saw was we have what we call a brain bus initiative. And so it's a state funded, it's actually a Winnebago that typically would travel around to diverse and underserved populations and provide education and service in those communities. Obviously we weren't allowed to do, or we weren't able to do that anymore. So we've had to park the bus, but we are again, still trying to provide those services virtually and on demand.
Right. Well, and unfortunately, I'm intimately familiar with what we've had to do with the American Cancer Society with a $200 million shortfall. So Brant, when you want to share with everyone how that's impacted cancer patients?
Sure, and I would say more so from a social distancing perspective than a budget perspective. Some of our programs, you know, we're focused on access to care, and 2 of our kind of hallmark programs with access to care are Hope Lodge and our transportation programs. And I think what makes Hope Lodge such a special and wonderful place is what's holding us back from reopening Hope Lodge. And it's communal living. The Hope Lodge is designed to have kind of small rooms for patients. They're traveling to Moffitt and other centers in Tampa for treatment. Small rooms, but big communal spaces where patients and caregivers can gather together with common dining areas, common kitchens, that kind of thing. So that was a program that we immediately had to shut down with COVID starting, or at least pause on, obviously not shut down, but this is a very vulnerable and sick population and generally an older population. And so we just could not bring them together in communal living during treatment. We are working with our medical team to safely reopen those as quickly as possible. But once again, it is designed, you know, we don't have individual suites where they have their own cooking and their own living quarters. So it provides a challenge. And then our transportation program. This is volunteers and partners driving patients daily to treatment. And obviously, with a very vulnerable population and many of our drivers being in an at-risk population as well, we have put a pause on that. And so again, not budgetary, but really safety driven. As Angela mentioned, research is a hallmark of the American Cancer Society, and I can go on and on the accomplishments through our research. But we too have continued funding all of our research to date. We fund about $100 million plus a year in research, but we are coming up on a fall cycle of new grants that are being presented to us, and really it may be the first time in our history that we actually have to cut that research budget for new grants. Again, we have committed long-term grants to many researchers. Those will continue. We are 100% committed to those and continuing to fund those. But we are going, just depending on our ability to fund those in the fall cycle, we'll make that decision to fund what we're able to at that point.
Well, it's gut wrenching to hear that any of that has to be cut. And, you know, you think back and it seems now like it was 20 years ago when Roy and I decided that our big push was going to be for finding rides to cancer treatments. And that was what we were going to lead the charge on. And now you can't even get in an Uber without a mask, and you can't even find an Uber half the time. And it's crazy the way our world has changed.
It's tough.
I happen to have, again, timing wasn't on purpose, had a business meeting with Florida cancer specialists today. And I was telling her about our panel this afternoon and what we were doing. And she told me a story about a gentleman that was supposed to have a colonoscopy in March. And she said, had he had his colonoscopy in March, it would have been a great outcome. He would have been fine. But he didn't, because he was afraid. He was afraid to go to the appointment. He was afraid to have the colonoscopy done. And now his outcome is very, very not good. And so I wanted to have Dr. Kazi and all of you guys really talk about what are the specific impacts that COVID is having on your respective organizations. What's going on with diabetes and cancer and Alzheimer's that wasn't necessarily going on prior to COVID? And I'll start with you, Dr. Kazi.
Thank you, Bridget. So I could probably talk about all of this for hours, but I'll try to be brief, but please feel free to cut me off. So by way of introduction, so for BayCare, most of my job is I am primarily an outpatient family medicine doctor. So I see patients all day, every day for chronic disease management and also preventive care. And then I also work as a medical director for population health with BayCare. So the whole topic of keeping our patients healthy and getting screening tests on time is something that very much has concerned me throughout this whole pandemic. And then I'm the clinical lead for the BayCare Medical Group COVID clinics. So for part of that, I sit on the clinical expertise work group, which is BayCare's team of experts looking at what data we do have about COVID and trying to decide how we intervene and treat the disease. So basically, I have a lot of different perspectives to talk about specifically how COVID has affected patients with diabetes. And there are many, many ways. So first of all, patients with diabetes, especially uncontrolled diabetes, are definitely at significantly increased risk for contracting the coronavirus. They're also at increased risk of severe disease requiring hospitalization, again, especially patients with uncontrolled diabetes. So diabetes and coronavirus are highly inflammatory conditions. They feed on each other. And so patients with uncontrolled diabetes just tend to not do as well as other people if they are affected. The other thing is that once those patients require hospitalization, they are at increased risk for complications, especially from the treatments. One of the treatments that is sometimes recommended is steroids. Steroids increase blood sugar. Patients with diabetes already obviously have blood sugar problems. So now they're at increased risk for COVID, they're at increased risk for hospitalization, and then they're at increased risk for complications from the treatments for COVID. The other thing is that even for patients who are not directly infected with COVID, it does not mean that they are not affected by everything that has happened. So in my outpatient practice, I've seen an increase in the rate of diagnosis of type 2 diabetes. I had one yesterday. I've seen an increased rate of uncontrolled diabetes for lots of different reasons. So a lot of the things that have already been mentioned, patients are afraid to leave their homes. I've heard all sorts of stories. I've heard I was afraid to go to the pharmacy to pick up my insulin, so I just haven't taken my insulin for 6 months. I've heard, well, I was afraid that because of the pandemic, the pharmacy is going to run out of my medication someday, so I've tried to conserve it by taking half the dose that you prescribed. And so on the back end for me, obviously, then I see, oh my gosh, now your diabetes is uncontrolled and you're at much greater risk for getting COVID and for complications, but the patients obviously think they're doing the right thing. And that is kind of, short-term, immediate, but then also the concern as well, long-term, is, as you were talking about, with the patient with a delayed diagnosis of, it sounds like probably colon cancer. One thing that we're starting to try to prepare for is, so if you have uncontrolled diabetes long-term, that increases your risk for things like heart disease, heart attack, and stroke. So what's going to happen a year or 2 years from now when we have all these patients who have had really uncontrolled diabetes for a long time? And so some of the things that we can do as a community are help to encourage patients to take control of their diabetes. That's obviously a big focus of the American Diabetes Association. Right now, patients are scared to exercise, which again makes it more difficult to get their blood sugars under control. They don't want to go to the gym. They don't really know where it's safe to go. They don't want to leave their houses. And so trying to find some solutions as a community of how we can still keep people active and eating healthy. I've heard stories of, well, I'm afraid to go to the grocery store, so all the food that I eat is processed food that I can order online to be delivered to my house, and I haven't had a fresh vegetable in 9 months. And so there's lots of things as a community that we can do to help try to support patients to get their blood sugars under control and help both in that short-term risk for COVID, but then also in the long-term outcomes.
Thank you so much, Dr. Kazi. And, I think some of the most, for me anyway, gut-wrenching photos were the ones where you got a mom in Alzheimer's care and they're touching the window, that was as close as they could get. And it's like, So Angela, can you talk specifically about how this has been for you guys?
Yeah, thank you, Bridget. And that is definitely one of the impacts that we have seen that we've been having to deal with COVID, with our caregivers especially, is that, because the long-term care facilities were closed, people couldn't visit their loved ones. Tracy and I have a fellow board member who lost his mother who was in long-term care during this pandemic. And, fortunately, they allowed him in those really late stages to come in and say goodbye. But a lot of people aren't having that opportunity because of this pandemic. And, here in Florida, we have the second highest incidence of Alzheimer's disease than all other 50 states. So a lot of the residents in these long-term care facilities are dealing with Alzheimer's and dementia. And it's just gut-wrenching. We had the opportunity to have a member of our team serve on the governor's long-term care task force that did just recently put some guidelines in place to reopen. Though we didn't get everything that we wanted to try to make it, that opening safer, it was a good step in the right direction. And I think other things are happening that will make that safer. But that's just one of the many ways that people living with Alzheimer's are impacted by COVID. Another thing, and for any of you who have been unfortunate enough to have watched someone with this disease, you will probably understand that, when you can't hug or kiss and you can't go outside without a mask and you have to constantly be washing your hands, a lot of times it's hard for a person with Alzheimer's to understand why, or to even remember that, I need to wash my hands, or I can't hug and kiss you, or I have to put this mask on and leave it on. So that's definitely another really big struggle that we are seeing with people facing this disease. And then our caregivers, if they're caring for their patient in home, usually, it literally takes a village with this disease. One person can't go it alone. And so when you're having to socially isolate and you're not able to have, in-home care, people come in and help you, other family members or friends, because of your increased risk now of exposure, it's putting an even greater burden on the caregiver to really try to manage the situation, which unfortunately a lot of times ends up in declining health of our caregivers. So it's certainly been a challenge for those who are facing Alzheimer's and other dementia.
Talk about a domino effect, right? Brent, you touched on this a little bit, but would you like to add anything?
Sure. Briefly, Bridget, the story that you shared is just all too common. In fact, what we saw is around cancer screening, mammography, for instance, we saw an 80% decline in mammography rates. So it's overwhelming. It's hard to comprehend. And some of that's starting to come back, but because, between mammography or the colonoscopy story you shared, we are estimating that we'll see incrementally an increase of 30 to 40,000 deaths a year. So when Dr. Kazi talked about the long-term impacts, this is something you don't just recover from. So screening is obviously a messaging that we are trying to shout from the hilltops. Talk to your doctors. The facilities have gotten themselves in a safe place. They've put safety measures in place. Understand your risks, but please, by all means, talk to your doctors about cancer screening. And then we've seen 79% of patients that are reporting either a significant delay or a disruption in their course of treatment for cancer. That obviously timing is everything. So again, that is coming back online. We're encouraging people to talk to their doctors. Our 800 number is getting swamped, and that's our message. It's really coming from two things, as you'd expect: fear, obviously, but also insurance, and also the fact that so many people are losing insurance and don't have the means for the treatment that they might have started or the screening that they would have qualified for earlier. So obviously, it's a big focus for us on the policy front.
Yeah, and I hope we're going to have time to get to that question. I knew this was going to be a difficult conversation, and that everyone was going to have a lot to say, and that we would all need to hear these different messages. I can tell you, as a breast cancer survivor, I was ecstatic when I got moved to once a year instead of every 6 months. And this year, when it came due in July, I was hesitant, and I mean, you just think about it differently, right?
Absolutely.
So before we all cry ourselves to sleep, has anybody created any new programs and services due to this pandemic? Is there any positive out there?
Bridget, I can share one. So, and it kind of flows really well into what we were just talking about. With social isolation being such a big issue, we were able to work with the Florida Department of Elder Affairs and came up with what we call Project Vital. It is a virtual, oh my gosh, I'm going to blank now, virtual inclusive technology for all, Vital. And what we really were trying to do is, because we did have our long-term care facilities closed, we knew that those individuals who were not able to get those visits from their family members were going to see a decline in their condition. And so we were trying to come up with ways to impact that in a positive way. And so we came up with Project Vital, which was funded through the Department of Elder Affairs. And we were able to provide tablets to long-term care facilities that were customized with information not only about our organization and the disease, but also could be customized and have multiple different, I guess, kind of IDs within it for the patient. So you might be able to upload pictures from their family, music from the genre that they like, different things that would help keep them engaged and connected. But ultimately, and most importantly, they were able to, FaceTime's probably not the right word, but at least connect with their loved ones virtually through the tablet to try to combat social isolation. And so we did that. We implemented it first in April, did phase 2 in June, and just started phase 3 of that this month. And that's going to include offering those tablets in home, where you have caregivers that are dealing with that social isolation from other family members and friends. So it's a really exciting program that we would have never really done, but will have long-term lasting effects and benefits even beyond COVID. So we're really excited about it.
Well, there's a positive in all of this. Brant or Pratima, do you have anything you'd like to add?
I'm happy to share just one story, Bridget. Well, we have always been known as kind of the most trusted independent source for cancer information and guidance. And we deliver that many ways, but kind of the core is our 800 number, 24 hours a day, 7 days a week, 365 a year. But we did add, when this all started, we added and it sounds simple, we added video conferencing to that, just what we're doing today. And the response from patients and caregivers who are at their wits' end, who don't know where to turn, has been phenomenal. And we had to, it was not an easy lift to add the video conferencing, there's privacy and that kind of thing, but story after story from patients that we serve that are telling us the benefits of that. I just saw a quote today, and I won't read you the whole quote, but it ended with, we were so alone until we spoke to you. It makes it so much more better to see your kind face when we're hearing your kind words. So whether it's critical information we're providing or guidance, or just that understanding ear and face at 3 in the morning when somebody can't sleep, it's a critical service that people need. And adding that piece to it has been incredibly well received.
Fatima, did you have something you wanted to add?
Yeah, so really quickly, so for the 34 million people in the US living with diabetes, what has not changed is, of course, like Dr. Kazi was saying, is the daily management that's required to live and thrive with diabetes. So how the ADA has shown up is that we've been able to create a COVID-19 resource hub at diabetes.org. We've offered extended hours for our Center for Information, and the volume on that has increased by 20%. And we've also advocated for a $0 copay for insulin during this emergency and pushed state and federal efforts to ensure that insulin is affordable and accessible. There's a whole list of things that I can go through, but more importantly, these are ways that we were able to still support those with diabetes, even despite loss of funds and the lack of fundraising we've been able to do.
Great, thank you. I'm going to combine, because we're starting to run out of time. We had so many important questions that we wanted to get to. I'm going to ask this to the panel. Not everyone has to answer, but if you have a meaningful answer, please do. I'm combining, how many of you saw your board step up and assume a leadership role and continue to push people in their networks to give? And in addition to that, how can those of us on the call who lead staffs, how can we encourage our employees who maybe aren't comfortable writing checks right now because they don't even know if they are going to be able to pay their mortgage next month? How can we encourage them to give back in ways other than writing checks? So, two-part question, who wants to take it?
I'll take a stab at it. So Bridget, our boards, whether it's our area boards, our national ACS Inc. board, or our CEOs Against Cancer chapters are stepping up daily. And if there's we talked about what's going well and silver lining, it's been unbelievable that volunteer leaders are as vested in our future as we are as staff. And so our board nationwide, we've initiated a $100 million research campaign, and our board committed to the first $1 million. The CEO's chapter that you're a part of, everybody has stepped up as part of that campaign. Not everybody can write a check today, and we get that, but those that can, we've been blown away by their generosity. And I think it goes a long way when our boards lead by example. I had Dan Johnson, who's the chair of the board in Southwest Florida, based in Tampa. We were talking, and he said, "Gosh, if we can't step up, then how are we going to be credible with anyone else?" And it was really great to see that leadership come through in a really tough time. As far as other people getting involved that can't write a check, that's a difficult one for us because we're not gathering. But I will tell you the price of admission for the Cattle Barons Ball this year was a lot cheaper than it has been in the past. And so there are virtual activities and events that, if you can't write a check, you can still be involved in. We have Making Strides Against Breast Cancer coming up. Obviously, we'd like the checks, but people are activating in many different ways and showing their pink during this month, either as employee groups or neighborhood groups or whomever. And so there are ways, and if you direct folks to our organization, we will find outlets for them to be involved in.
And Bridget, I can just add a little bit to that. I agree. And I think you probably, having chaired the gala, saw some of this firsthand. Our board has definitely stepped up in big ways. And when we had to postpone the event, we had to go back and talk to our sponsors, many of which are our board members, and ask them, how they wanted to manage their contribution. And not only did the majority of them say, keep it, but here's more. They actually, in some cases, and Tracy's a great example of that, stepped up and gave more.
And what does that say about our community? I mean, everybody on this call should be like, wow, right? Because we were really, really scared when we said we had to move the gala, like what's gonna happen with the sponsorship dollars? And we didn't lose any.
Yeah, which is so impressive. And I think it speaks volumes to you and your committee and the relationships that you all have made and the reasons that these individuals engaged in the event to begin with. So, and then just to touch on the volunteer piece of it, there are a lot of ways to still engage in volunteerism, even though we can't gather. And so, what I would say to you is our volunteer committees who are planning these events, we need new creative ideas now more than ever. So, if you're interested in getting involved and, we're doing it virtually. So it's really just putting your skills and experience and knowledge and sphere of influence into the pot to help us come up with those new and creative ways to continue to engage people in our events. So that's a big one. Joining the board is another. We're looking for those, influential decision makers who are passionate about the mission. It's another way that you can get involved in the organization. Even just kind of helping to make phone calls. We're trying to stay in touch with those individuals who are out there raising money for us and doing all of those important things. And so just helping us call and say thank you. We appreciate what you're doing. Little things like that are unique ways that you can still engage and volunteer that aren't going to cost you anything. Maybe a little bit of time.
Thank you so much, Angela. Pratima, do you have anything you'd like to add to this?
So just to echo what Brant and Angela have said, it's really, we understand people, not everyone can write a big check, but those who are able to have really shown up, and we are so appreciative. And even when we thought that there was no way we'd get close to our goal or even get to where we were last year, right before we had to pivot to virtual, we ended up exceeding our goal somehow. God, everyone take a drink. We exceeded our goal for Tampa's tour, and we were just so incredibly proud of that. And being able to do that was thanks to the connections that were made and the doors that were opened because of the leadership that we have involved already, and then the new people who got involved. So we're so appreciative of the community, really.
Well, and I'm going to say again, for those of us that live here and work here and are raising our families here, that's a big testament to this community. That's pretty amazing, considering Bridget, everything that's going on. Yes.
Sorry, I just have, as you all were talking, it just strikes me. You talk about board member activation and board members stepping up, and we wouldn't be here right now on this call without board members thinking very creatively. And I know Pratima and Angela can speak to just the creativity and the calls that folks are reaching out. So another, kind of real shout out to Roy for initiating this. I mean, that's the kind of leadership we've seen. And even new board members, Travis Jennings, I'm not sure if Travis is on this call, but with Finance Cape, he is offering donor experiences, yachting experiences for people that are stepping up with new gifts to the organization. So I know there's a lot of we've been a lot of melancholy out there about things that are happening, but it's just it's really heartening to see some of these folks step up in new and different ways.
He is on the call, and I saw a big old smile when you called him out. So, All right, we are running out of time, but I do want to get to the public policy part of it. And because you brought it up, Brant, and because you're already not muted, how has this impacted your public policy efforts?
Yeah, we have doubled down on two accounts, Bridget. And the first and foremost is really advocating for patients. I mean, so many people are going through changes, and there's a lot of legislation in Washington. And you know, there are many things that we do separate, and even you could call the three organizations in some ways competitive on this call. But where we come together in coalitions is on behalf of those that we serve. And so in Washington, in Tallahassee, we are members of coalitions that are constantly advocating for ensuring that every bit of stimulus legislation, everything that's out there, we are looking out for the patient. You know, whether there's insurance loopholes that we need to close, whatever it may be, that patients are given the priority in this, and you're seeing that daily. But we work very closely with our with organizations like that are on the call today, and many others, and coalitions to really represent those that we serve together, because the legislation goes across different diseases and conditions, obviously. And lastly, we are all parts of organizations that do not maybe benefit from some of the PPP funds and those kinds of things. So kind of secondarily, our policy folks are looking for opportunities to participate in that as well, to no avail so far.
You know, it's funny that that you said that you compete to a certain degree. That was one of the things when we first started talking about this that we thought might be a problem. And I think, you know, when we're looking for those bright spots, the one thing I have to say is that we were all like, you know what, this is about COVID-19's impact on other diseases and on nonprofits in general. And none of you had an issue with being on a call with somebody that you quote unquote compete against. So
no, these other organizations, I mean, I you know, and many others, there's a lot of great organizations and great causes.
All right, so I have one last question, but I want to give Angela and Pratima an opportunity to answer that last one. Any impacts on public policy for you guys for diabetes and Alzheimer's?
I can just add that, you know, one of our most recent advocacy wins that we're really proud of is that starting in January of 2021, all seniors enrolled in Medicare and Medicaid plans will pay no more than $35 per month for their prescribed insulin needs. And that's so huge because, like Dr. Kazi was saying, people ration their insulin for other reasons besides just COVID. Sometimes they just can't afford it. And it is really sad. So we've made it a mission to, you know, really work toward making insulin affordable. Our state advocacy team has also been able to work with legislators in individual states to date, and we now have 12 states that have passed the insulin copay cap legislation. So really exciting news there.
And Bridget, I'll just add to that. You know, I agree with everything that Brant was saying earlier about some of the struggles that we're having. You know, being able to meet and talk with our legislators and get, you know, that huge number of advocates in front of them, you know, to really share their stories is something that's really powerful. And I'm sure all of our organizations do that when we have the opportunity, but we just can't do that now. So we're having to find really unique ways. And we've done some virtual town halls that have been effective. But in terms of wins, you know, something that we have done recently, hopefully you all have heard a little bit about it, but the Promoting Alzheimer's Awareness to Prevent Elder Abuse Act, that's a mouthful, just passed in the House and the Senate and should be on the president's desk soon to sign into law. And if you're not familiar with that, it is making sure that our first responders and social workers, those who are faced with elder abuse and exploitation, are getting the training that they need to know how to deal with individuals who are dealing with Alzheimer's or dementia, because a lot of times they can't be their own advocate. It's hard to share the experience that they've had, the abuse or the exploitation. And so The act will require training for those individuals who are faced with making those connections and dealing with those issues. So we're really excited that we were able to get that passed even in a pandemic.
That's awesome, really awesome. So I have to say thank you to our panelists, obviously Dr. Kazi with Baycare, Angela with the Alzheimer's Association, Brant with the American Cancer Society. I'm not sure if you can see Jason, but he's doing a not so shameless plug for his Real Men Wear Pink campaign. He's pretty close to his goal of $3,500. So if you're not Facebook friends, go Facebook friend him and give him $5 or $10 or $5,000, whatever.
No, we want to crush that goal. We got a long way to go. Ron Miranda's on the call too. He's another real man wearing pink. So consider him as well.
Well, and again, as a breast cancer survivor, I can't thank you guys enough for those efforts and for putting your heart and soul into it. Obviously, an opportunity to thank the sponsors, because again, without them, these organizations would not have had the opportunity to talk about what's going on during these really weird times that we're in. So thank you, Baycare. Obviously, thank you, Pilot Bank, and thank you, Cigna. And we have asked all of the panelists if they can stay on to please stay on and continue the conversation. We're always here, you guys know that, so grab a cocktail, and if you need to get out, get out. But yeah, we would be remiss if we didn't say thank you for being a part of this conversation. Please carry it out there into the community. You're all influencers. You all have people who listen to what you have to say. And if you can say to them, hey, have you thought about the impact on these nonprofits? And talk about some of the things that we talked about today, you could really, really make a difference. And hopefully that's what we did today. Thank you again for being here and for being part of the TBBW family and community. And I hope you all stay on and grab a cocktail and continue the conversation.
Thanks, Bridget, so much for having us.
Thank you, Bridget.
Thank you.
So at this point, you are free to come off mute, all of you.